allow me in this presentation to talk about what is called Ectopia Cordis. So from your appreciation or from your understanding, what is Ectopia Cordis? I encountered this case at our radiology department. What you are seeing here, this is the thorax, and then this you can see that's the spinal bone, and what you can see here is the heart. So you can see that the fetal heart, the apex of the heart is actually beating outside the thoracic cavity. So when you do have got a case of this nature whereby the heart is found outside the thoracic cavity, either in the abdomen or just outside the thoracic cavity, we call that an ectopia cordis, or a heart at an ectopic site. So you can appreciate what we have here. The heart is actually beating outside the thoracic cavity. You can see the fetal ribs, the ribs here, and you can see that the heart is protruding outside the thorax. So it's starting from the thorax and it's extending all the way outside the thorax, a condition that we call Ectopia Cordis. So you can appreciate here from the armor trace here what we have. The heart apex is actually outside the thorax, and you can appreciate the thorax is here. So this is a typical case again that we came across at our radiology department of a condition that we call Ectopia Cordis, and you can see the sluggish movement of the heart that we have. Actually, the fetus also had bradycardia, so you can see the slow movement of the heart. So it's beating slowly. So this is beating very much slowly. So this is the typical case of a condition that we refer to as Ectopia Cordis. The heart is extending outside the thoracic cavity, forming a pouch that we can see here. So this is Ectopia Cordis. Again, on this tint map, you can see that the heart is actually beating slowly here, and it's extending outside the thoracic cavity, a condition which we refer to as Ectopia Cordis. Ectopia Cordis generally means a heart at an ectopic site. I hope you're appreciating what I'm talking about. So when you're doing an ultrasound scan, it needs one with an eagle's eye to check at everything in a glance or at once. So you do not have to rush those scans. Check for these obvious abnormalities. They are easy to miss as well when you're doing an ultrasound scan, because from this end you can actually see that the patient also had oligohydramnios. So it needs one to have a meticulous eye to actually see that the heart is beating outside the thoracic cavity. I appreciate your time. I hope you don't forget to subscribe to our channel and share the link to our channel. Thank you so much. Thank you all.